Headaches that are benign or that have absence of organic disease include tension, cluster, migraine, and menstrual headaches. Headaches can also occur secondary to primary or pathological causes, such as in intracranial tumors, hemorrhage, acute systemic infections or central nervous system infections, severe hypertension, acute or chronic ENT disease, such as sinusitis, and lumbar puncture. Diagnostic tests that can help in establishing a diagnosis include CT scan, MRI, EEG, and lumbar puncture. Remember that lumbar puncture is not indicated if there is increased intracranial pressure. Let's distinguish between tension, migraine, and cluster headaches. Tension headaches are typically muscle contraction headaches. Triggers include fatigue and stress. They're typically located posterior neck and shoulder and at the base of the skull, sometimes at the forehead symmetrically. They can occur frequently and can last for days. The character of the headache is usually a tight band-like discomfort that is gradually and variable. Treatment includes analgesics, caffeine, which has been found to be helpful, cold packs to the forehead, and decreasing stimuli, for example, in a dark room. Prophylactic medications can help if there is a very frequent occurrence of tension headaches. Migraine headaches have a familial component. Triggers can include missed meals, foods with tyramine, menstrual cycle, stress, and believe it or not, relief of stress can provoke a migraine, bright lights, and fatigue. The headache tends to be unilateral. However, it can be bilateral. It can occur with or without an aura. An aura is a perceptual disturbance experienced prior to the migraine or, in some people, prior to seizures. The duration of a migraine can vary from 4 hours to 72 hours. The character is throbbing in nature, pulsatile, and physical activity can intensify the pain. Associated symptoms include being photophobic or phonophobia, nausea and vomiting, anorexia, and visual disturbances, such as jagged edges with the vision. Treatment typically includes decreasing stimulus and providing a quiet, dark environment, over-the-counter medications, caffeine, or abortive medications, such as narcotics, which we typically try to avoid. Triptan medications such as Zomig and Triptan can be helpful. Antiemetics if there's nausea and vomiting, and prophylactic medications can be very helpful in people suffering from frequent migraines. This can include beta blockers, tricyclic antidepressants, SSRIs, and calcium channel blockers. Also encourage patients to limit MSG, vinegar, chocolate, alcohol, and caffeine. Cluster headaches tend to occur more often in men, can be related or triggered by alcohol consumption. They are typically located periorbital in the form of a migraine. Bouts can last 15 minutes to 3 hours, and a person can have 1 to 3 bouts, cyclically, lasting 4 to 8 weeks. The character is deep, boring, intense. Associated symptoms have included, but rarely, the development of Horner syndrome. Treatment that can be helpful includes oxygen at 100% for about 15 minutes at the onset of the attack. Intranasal lidocaine can be helpful, sometimes blocking or neurostimulation. And again, prophylactic medications can be used. These include prednisone, lithium, verapamil, and others. Let's not forget about the possibility of a lumbar puncture headache or a post-concussion headache. A lumbar puncture headache can occur 48 hours to 12 days after a lumbar puncture. It is worse with sitting or standing, typically dull or throbbing in nature, and occurring in the occipital frontal region. Associated findings include nausea and a stiff neck, blurred vision, tinnitus, photophobia, and vertigo. It can resolve spontaneously over a few days to months. Management of a lumbar puncture headache includes possibly caffeine and most frequently an epidural blood patch. An epidural blood patch of 15 milliliters of autologous blood can be injected at the site and can provide immediate relief. For a post-concussion headache, the person can have dizziness, vertigo, and impaired memory associated. Anxiety, irritability, and difficulty with concentration as well. Again, provide symptomatic management in addition to analgesia.